tell me a little bit about how you kind of coach and consult those private practice physical therapists in your role as CEO at Medical Billing Center.
So part of what we do as a full service billing partner at Medical Billing Centers help individuals, individual practice owners strategize and game plan the path to success for their clinic. And much of that starts with looking at your numbers. Any business, you have to know your numbers. If you've ever watched Shark Tank, which occasionally you do, or occasionally I do, you have to know your numbers. And it starts with your numbers. And when you look at your numbers, you're like, okay, which metrics or numbers are within industry standards, above, below? Where's our opportunity? And so from a billing and collections perspective, we enjoy doing that. It's like, here's your opportunity. Here are the reasons or rationales, denial, whether it be denial codes or whatever that may be a contributing factor to those metrics. So we walk through the metrics, we look at standardized metrics, we look at where the opportunities are, and then create a path to impact those metrics to create success. It's very individualized. There are common themes for sure, but not only which metrics are going to positively impact your practice, but also the how-to. Sometimes it's easy to see on paper, oh, well, our charge diversity needs to be better. Well, how do you do that? It's not so easy, and it will not happen if you just send an email to the staff and say, oh, please charge better. It takes coaching. PTs need to know why. And so we'll embrace that challenge with the practice owners. We'll do webinars at lunch, the old lunch and learn, just like we're sitting around the treatment table in the gym, and we'll talk billing and we'll talk why. And ultimately, many of those conversations center around what's best for the patient is also best for business.
That's right. And then based on your time at Medical Billing Center and the consulting that you've done with these clinic owners, what do you think is a common theme? Like if you could take the last 3 years and say the common theme that I have experienced with practice owners, the biggest problem is this.
The first one that comes to mind is owners not prioritizing time to coach their staff, to lead their staff. Many of the private practice, they started their practice as the only clinician. And they believe that the only path to success is I have to see more patients. And they feel as the owner, they have to see every single patient they can. And so they see more patients than anybody else. They've now grown, maybe it's still one location, but maybe they're five staff, 6 staff. Or maybe they have another location that's 30 minutes away or something like that. They still believe I have to see every single patient. I have to see the most patients of anybody. So the most common theme that comes to mind first is as clinics start to grow and scale, that the owner not prioritizing time to actually coach staff and realizing that if I actually impart my wisdom and coach the staff to a standard, that is going to create greater organizational success than the owner seeing those 2 extra patients on that particular day.
All right. What do you wish that PT clinic owners understood about MBC?
Boy, that's a challenging question. I hope that the leadership at MBC, our AR directors, our supervisors, our staff, can relay to anyone that interacts with MBC the simple fact that we care. We care about private practice physical therapy. That's why we were started. We were started by a physical therapist that knows and understands the impact that private practice physical therapy has on their community. I'm biased because I'm a PT, but I truly believe that physical therapists, as much or more than any other healthcare provider, impacts the quality of life of our patients. We're spending more time with the patient. It's not a 5-minute follow-up and then and then you're back out the door. We spend time with the patients 2 to 3 times a week. For an hour, we get to know the patients. We know their families. We know their caregivers that support them when they come to their visits. We appreciate that. We know that. We know the personal approach and connection you have with all our patients. We understand it. We believe it. We know how important it is. That's why we're here. Our task is to collect money. Our mission is to support private practices so you can take care of your community. We understand your role in communities, whether it be a big urban center or a small rural area. It is a vital role in your community. We understand, we appreciate that. So we care about that, and that's why we do what we do.
So, how is working with MBC different than using a different billing company, potentially a tech first billing company?
Good question. My impression is, because I've never worked with another big tech company, we've interacted with quite a few, and we do interact with quite a few tech companies frequently. Part of what I have done in the last 2 years is consistently monitor technological advancements in revenue cycle management, and it's changing drastically. Obviously, everybody talks about artificial intelligence and generative AI and all that kind of stuff, which is well beyond my knowledge base. I'm an old PT, but it's important to keep up with all those things. So it has changed significantly over even just the last 2.5 years. I believe Medical Billing Center is unique in the fact that we still hold true to a full service billing center. Our promise is to be your back office. And we happen to be your back office. We may not be on site. We might be your remote back office, but we're a true billing partner. We're more than a system that's plugged in that sends out to the clearinghouse and sends out to the billing companies. We're here to partner with you. One way we do that is we take all your patient calls. You truly partner with us when you have a patient that walks in and they says, I have my statement. Now, can you help me explain this? I don't understand this adjustment. And if it's even remotely beyond the comfort level of your front desk, they have a phone number there, say, please call our billing department, and they'd be happy to answer your questions. And so we accept those calls. We want those calls to come to us. We want to interact with the clients and help them understand how insurance processes, because many times insurance does not process the claim in the same manner that they verified it initially. And so we understand there's sometimes a disconnect. We understand that going to physical therapy is a little bit of a hassle. It's not cheap. It's expensive. It's very valuable. It should be. But it's a challenge for people's schedule. It's a disruption for their day. And there's a level of anxiety that comes with recovering or having a surgery or having an injury. We appreciate all that. We understand that. We understand how to communicate with clients. So we believe that customer service beyond the system technology is extremely important, and we believe that's one of our greater assets.
That's true. All right. What does ongoing support actually look like when a clinic partners with MBC? And what does communication look like I could answer this question, but from your perspective, what does it look like when somebody chooses us?
Well, it starts with establishing expectations during the onboarding process. So we have a standardized onboarding process that takes generally about 6 weeks. There are some unique challenges based on what system a particular client might be functioning in their EMR. That's what I mean when I say systems. But we have an operations team that is responsible for onboarding. to the go live date till through the first month. During that period of time, they will be introduced to their team. You will have a dedicated account receivable representative. That individual has a supervisor, that individual has a director. And we are all responsible for making sure that we're meeting the goals, we're meeting your expectations. So the communication occurs from the client to the AR representative. We have recently embraced technology to implement a shared file system through the Teams platform to where the front office can interact with their AR representative through a live spreadsheet. We understand that email fatigue is a real thing. Trying to search and find emails and categorize emails and download and save to a file and rename, and we're trying to reduce the number of clicks, but maintain a high level of communication and efficiency. So that's just one thing that we've done recently. However, you can always pick up the phone. You always pick up the phone. You have a supervisor, you have a director, and you have myself that we enjoy. Again, as I mentioned before, strategizing. Beyond that, after a new client is onboarded, we want to have at least monthly calls for the first 6 or 9 months. We're happy to continue those calls as long as you would like. It goes back to being the billing department. With my practice, I wanted to meet with my billing director at least once a month to get an update. What's our aged AR? What's our DSO, which is day sales outstanding? How are we doing? What's our collection rate? What's your denial rate? Hit those high level metrics at least once a month. And we coordinate that with each client, whether they want to have a call in person, whether they want to customize a report. Hey, just send me the numbers. If I have questions, I'll let you know. And we'll maybe have a quarterly face-to-face call. We're glad to do any and all of those things to best communicate with the client, and we'll tailor that to their specific needs.
That's great. All right. So I think this is our final question, and it is, what are PT practice owners dealing with right now that you think is not talked about enough?
What are they dealing with that is not talked about enough?
So common issues we help our clinics with. So,
well,
I mean, the first one that comes to mind for me would be
I'm
front
sorry?
desk. I would say the first one that comes to mind for me would be front desk.
Well, true. So I was actually thinking a little bit more specific than that. So, but yes, we're thinking the same thing. So, some of the challenges that are facing from a billing and collection perspective, I believe a few of the challenges that are the largest obstacles impacting physical therapy private practice clinics are authorization. It's utilization management. So under the umbrella of utilization management is authorization, coordination of benefits. Maybe a side shoot of that is credentialing. Credentialing is not technically utilization management, but I think it probably is actually is a little bit. So the utilization management imparted by insurance companies on healthcare providers, particularly physical therapy, does receive a lot of discussion. However, I don't know that there's a lot of, like, what are we going to do about it? You have to commit. You have to commit to standardize procedures. And what I mentioned earlier about commit to coaching your staff, commit to coaching and investing in your front office. Because utilization management is an obstacle. You really got to dial in coordination of benefits. You really have to dial in authorization, how you track it, and how you communicate with the patients about it, that it's their benefits. So that's pretty common theme. All of us physical therapists enjoy treating patients. And if we could do that all day, we'd be as happy as could be. The headaches are managing the insurance And it's really the hard part's not sending the claims and getting the claims back. The difficult part are the hurdles or the roadblocks that are in place for payment. All the denials, diagnosis codes. I was just had a call with a client this morning, and we were looking through their shared file. We call it the clinic correspondence sheet, and we can filter based on topics. So the topics that we need that we're relaying back to the clinic say, all right, this claim was denied or it's being held up because of X. And we can filter that when you say, what is your individual clinic's top 3 reasons that your claims are being slowed down or denied? One of the top reasons this morning for this clinic was diagnosis codes. So we are not coders. We do leave that to the discretion of the clinician. However, we do help with guiding you. Well, most insurance is they're gonna kick it out if you do this diagnosis code. The general recommendations we make is, and the most common mistake they make is physical therapists make is putting the medical diagnosis first. Osteoarthritis of the knee. Well, we're not going to change the osteoarthritis of the knee. That arthritis is going to be there no matter what we do. We want to use the functional diagnoses. What are we going to impact? Abnormality of gait or what have you. And you also want to be as specific. If you have the opportunity to choose right versus left versus bilateral or something like that, you want to be as specific. And then if you have to put the medical diagnosis down at the bottom, I guess you can, but you don't want this laundry list either. So we want to work with people about giving them general guidelines about how to manage those obstacles that are kind of under the auspices of utilization management.
That's great. Awesome.